Hello everyone. I have chosen to do my project on Kabuki syndrome. Here is a list of some of the topics that we will be covering in this presentation. Alright, so as an introduction of why I chose Kabuki, my daughter actually has been diagnosed with this disorder. We did not know that anything was wrong until after she was born. She was born with some congenital heart defects and a cleft palate that were not diagnosed in utero. So it came as a pretty shocking surprise. We had many questions of why these things had happened. There was no family history of any of these congenital defects prior to Lucy's birth. We got the diagnosis, I would say, I think it was like 8 months after her birth. It did help answer many questions, but it brought forth many more, mainly as we did not know how it would affect her development. It is a rare enough disorder. It's usually only about 1 in 32,000 births, so not many health professionals know too much about it unless they have dealt with it in the past. A lot have said that they remember kind of covering it in school. So I think it is an area where education can be very beneficial to healthcare providers if you ever help these patients in the future. It is a very complex genetic syndrome. It affects multiple different body systems and requires a lot of coordination with different specialties. Some of the common clinical manifestations of Kabuki include craniofacial dysmorphia. That includes abnormally long eye openings with version on the lateral third of the lower eyelid, arch and broad eyebrows, a broad nose with a short nasal tip, large prominent cupped ears, and palate defects. Another very common symptom is mild to moderate intellectual disability. There can be some endocrine issues, most common being hyperinsulinism, and then short stature, and then premature thelarchy in females. Continuing on with clinical manifestations, 70% of these kids suffer from feeding difficulties. There's many different reasons behind this. One major one is GERD. They also can have poor oromotor coordination and swallowing difficulties. And then obviously if they have a cleft palate, that just makes things more difficult. So you got to watch out for failure to thrive in these kids. Congenital heart disease also affects about 70%, and there's a wide range of defects associated with Kabuki. Can range anywhere from minor septal defects to coarctation of vessels, ventricular defects, and then hypoplastic left heart has also been observed. Joint hypermobility is also very common, puts them at risk for dislocation of different joints, and then persistent fetal fingertips is also a cardinal sign. Compromised immune system in some children, I don't have statistics on this, but puts them at risk for autoimmune disorders. Genitourinary system defects can include mainly kidney, either just not formed correctly, or they're in the wrong place, or there's many different things that can affect the kidneys with this syndrome. 10 to 39% experience neurological symptoms such as seizures as well. Causes of Kabuki syndrome, there are two types. There's an autosomal dominant known as KS1. It's the most common type. It affects greater than 80% of the known cases. There's more potential complications with KS1. That is what my daughter has been diagnosed with. Then there's KS2, which is an X chromosome dominant. It's rare, only affecting about 6 to 10% of the cases. There's more clinical manifestations in males versus females with KS2, and these patients are more likely to experience that hyperinsulinism and the hypoglycemia. Most known cases are de novo with no familial trace, which means there's no family history of it. It's just a new mutation. Pathophysiology of Kabuki can be very complex since it is a multi-system disorder. In terms of what causes the issues, there are genetic mutations which cause an absence in certain enzymes which are necessary for normal histone methylation. Without diving too deep into the molecular genetics, basically what that means is it disrupts gene expression, and that can be in multiple different systems. And then some of the pathophysiology behind some of the comorbidities with Kabuki includes like cleft palate, like I said, that can affect nutrition and feeding. They can have speech problems. They're at an increased risk of ear infections. Congenital heart defects can lead to poor tissue perfusion, heart failure, and death, depending on the severity of the defect. Endocrine disorders can lead to hyperinsulinism, hypoglycemia, developmental delays, and short stature. Genitourinary disorders can lead to kidney failure and then buildup of toxins in the body if the kidneys aren't able to do their jobs properly. And then immunocompromised individuals may have frequent infections and autoimmune diseases. Diagnosing Kabuki syndrome includes an individual expressing a combination of the 5 cardinal signs, and then genetic testing can confirm whether they have one of the 2 mutations. The 5 cardinal signs include a combination of some of the facial features that I had listed previously. They can also have some skeletal anomalies. There are dermatoglyphic abnormalities. Persistent fetal fingertip pads are very well associated with Kabuki syndrome. Intellectual disability on any range, and then postnatal growth deficiency. Managing kids with Kabuki syndrome, they need to be monitored closely for their development, as they are at a fairly high risk of intellectual disability. So identifying any deficiencies in their development early is essential for making sure that they get the proper support services needed in order to develop properly. Feeding difficulties, really need to watch the nutrition in these kids. My daughter had to have a nasogastric tube for the first year of her life, and then we transitioned over to a G tube following her palate surgery. But then as soon as we got her palate fixed, she was able to start eating and drinking normally. So the G tube has since been removed. Heart defects, they may require surgical intervention, medications, and then worst case scenario, heart transplants. My daughter did require surgical intervention. She did have large VSD as well as a large coarctation or aorta. Immunology will most likely have to be consulted just to rule out any autoimmune risks. Endocrine consult is pretty important. Make sure that we're not experiencing any hyperinsulinism, as well as monitoring kind of the growth, making sure that there's no growth hormone deficiency. Genetic counseling is huge in these families because it's a lot to take in, and there's many specialties that a geneticist can set up for the families. Prognosis of Kabuki syndrome, so it's a non-progressive disorder. So there is no direct altered life expectancy. Obviously, severe comorbidities can influence this, especially with the congenital heart defects. We consider a holistic health assessment in these individuals and families. We need to take into account that most known cases of Kabuki are de novo and can be quite shocking and take a toll on a family's mental health. In my case, we had no warning signs prior to birth, so the beginning of Lucy's birth was it was a time of crisis. We were in the hospital for 30 plus days, heart surgery. So just checking in with the parents frequently is extremely important. The patient will need to be closely monitored through development, especially in the first couple years of life. It's crucial to make sure that they're hitting their milestones, and if they aren't catching that early, and getting support services added on quickly. And then there is a high likelihood of passing on the mutation to future offspring, with it being a autosomal dominant or an X chromosome dominant disorder. Some health education to think about with these affected families. Genetic counseling, I think, is extremely important. Geneticists are more educated in these rare genetic syndromes, so they know what to look for. They also can easily make referrals to other specialties. And then health education needs are going to look different from case to case depending on what exactly is affected. There might be a child with a minor ventral septal defect that doesn't need surgical intervention versus one that has a seizure disorder and a hypoplastic left heart that is going to need a heart transplant shortly. Also, providing support groups can help families process and manage the disease as well. To summarize what we've gone over today, Kabuki syndrome is a complex multi-system disorder with two pathogenic variants. Most cases are de novo or new. Early years of life are crucial to monitor for development in these children, and then strong support for the family and good health education for the parents is necessary. Thank you for watching this presentation. Here are my references that I used to gather this information.